Hi, my name is Saklan Shabir. I will be discussing the strengths and weaknesses of nonverbal communication with you in the health and social care sector. Introduction. Communication is an important skill in this field, and having a grasp of nonverbal communication can help in improving patient care. What is nonverbal communication? Nonverbal communication is an essential skill within health and social care because not all patients can use words effectively. It reinforces verbal interaction. In some cases, substitutes for it for intense patients with disabilities, language barriers, or medical conditions. Sometimes prefer nonverbal signal. This presentation will discuss the effectiveness of body language in understanding relationship and what is can actually cause. Type of nonverbal communication. There are many type of nonverbal communication. Body language can be a sign of confidence or uncomfortable state, such as posture and movement. Give us the emotional expression of happiness, pain, or anxiety through facial expression, making eye contact, signal that you are paying attention and respecting them. The tonality of voice might differ, even if the word where the some personal space matter too, especially in healthcare where bounded foster trust. Importance in health and social care. Health and social care makes significant use of nonverbal communication. It's make one more attuned to the emotion of and the need of patient. This also fosters trust and rapport between the patient and the caregiver. Nonverbal communication can especially benefit older people in many cases because they are more vulnerable because of physical limitation act, who rely on it for a primary means of communication altogether. It increases the quality of care and patient satisfaction. Strength of nonverbal communication. One big merit of body language is that it provides feelings not using words. This is helpful with language limitation. For instance, a patient's facial expression, even when they can't speak, can indicate pain. Eye contact and gestures also reinforce trust and make patient feel at ease. This enhances communication process in the healthcare setting. Practice strength. Nonverbal communication has its uses and is also really useful in real health and social care settings. Facial expression can be a guide for nurses to recognize pain. Making eye contact can help patients feel respect and recognize. When we use positive body language like nodding or smiling, we provide empathy and understanding. This result is stronger relationships and better patient experience. Weaknesses of nonverbal communication. But in spite of this strength of nonverbal communication, such an answer is at times ambiguous and open to interpretative variation. Gesture, expression, or phrases may also be interpreted differently depending on culture. Eye contact or intent might be respectful or not in one culture, or even rude or appropriate or inappropriate in another. If handled poorly, this can result in misunderstandings. Challenges to effective nonverbal communication. Some challenges in doing nonverbal communication well. Signals may be misinterpreted by healthcare professionals because they may not be trained for experience to read signal, and emotional situations and lack of time also can make an impression on understanding. Hence, for that there is need for professional to be trained on how to read between the lines of misread of nonverbal messages to avoid problems. Person-centered care. Person-centered care consider the person they are. Professional can use nonverbal communication can be more knowledgeable about patient needs and wishes. It also makes patients more engaged in their own care. This results in trust for patient and quality of care. Nonverbal communication plays a very important role in teamwork within health and social care settings. In busy environments like hospitals, professionals often do not have enough time to communicate everything verbally. That is where nonverbal communication becomes very useful. For example, eye contact, gestures, and facial expression can help team members quickly understand each other's intention. A simple nod can show agreement, while a serious expression can indicate urgency about a patient's condition. This allows the team to respond quickly and provide effective care. Positive body language, such as open posture and active listening, also help create a supportive and respectful working environment. When team members feel valued and understood, it improves collaboration and teamwork. However, it is important that these signals are clear, as misunderstanding can still happen, especially due to culture differences. Therefore, proper training and experience are essential. Inclusion. Nonverbal communication is a vital part of health and social care. It helps professionals understand patients better, build trust, and work effectively as a team. Although it has some limitations, its strengths make it an essential communication tool. By improving nonverbal skills, healthcare professionals can provide better quality care and achieve positive outcomes for patients.